You know, with the COVID pandemic, people dealing with asthma might feel added stress during activities every day. We want to help ease some of those concerns. We've got Dr. Robert Greer, an asthma and allergist physician, here with some more information for you. Dr. Greer, thank you for stopping by.
Thank you for having me.
So we know that when you have asthma, it's hard to breathe. Your airways are inflamed. Can you talk about the triggers?
Sure. So the most common triggers we see with asthma are viral. So if you have viral upper respiratory infections, that's a common trigger. Exposure to airborne pollens or airborne aeroallergens, such as pollen or dust mites or cockroach, that also can contribute to asthma flares. And then weather changes, be it hot or cold, as well as irritants that we come in contact with, such as cigarette smoke. So many triggers out there that are all around us all the time.
And I didn't realize that there are actually different types of asthma. Can you explain?
So there are a couple of different types of asthma. What we see most common is allergic asthma or inflammation of asthma. But mostly the treatments will be generally the same unless the severity changes, and then the type of asthma opens you up to different treatment plans based on what you have.
You know, with the coronavirus, the symptoms vary, but one of them is about breathing. And with asthma, what types of conversations are you having with your patients who are concerned about getting COVID or having it?
So it's a question that we do receive often, patients that have asthma and are worried about COVID, and we've been fielding these questions for a good bit now. But the most common question is, am I at an increased risk to get it? And if so, am I at an increased risk to have complications from it? In the U.S., the studies and the data, of course, we're learning everything about this, but the studies we have thus far show that asthmatics are actually not at an increased risk of contracting COVID-19. There may be actually a slight benefit to the common treatments used for asthma, which is inhaled corticosteroids, that help to prevent some of the infection. So if anything, it's kind of an even playing field, or maybe a slight decreased risk, but again, we don't have overwhelming data.
Wow.
There was a South Korean study that said maybe there was an increased risk, but most of ours here in the U.S. say that no, actually, there's not an elevated risk thus far.
That's encouraging to hear. And really quickly, since you touched on it with the treatments, does it always include a steroid?
Not always. There are different treatments of asthma, different severities. Sometimes we'll start with just an albuterol or rescue inhaler, and we can step up therapy based on the severity of asthma. Singulair or Montelukast is a generic name of a tablet that can help with entry-level or basic asthma. But as it worsens, inhaled corticosteroids are the go-to, and then we step up on those doses and then can add other longer-acting beta agonists, which is the longer version of albuterol, to those medicines. And then if it's very severe, we have even other medicines, biologic medications that are new as of 2004 and beyond. There's 3 or 4 medicines that we can go to if we need to for the very severe asthmatics, if they fit criteria based on the type of asthma.
Right. Wow. Thank you very much, Dr. Greer. A wealth of knowledge. We appreciate your time.
Yes, thank you for having me.
And we're going to have this information on our YouTube channel shortly. Subscribe. That's the Fox 10 YouTube channel, and that way you can watch this interview and share it with someone you know.